Today we have a lot to discuss, so come closer. Why do you think that we need to prioritize rural health? When we think of viral outbreaks, our mind often jumps to crowded cities, packed hospitals, urban chaos, and the rush of emergency room. But what if I tell you that the real ticking time bomb lies far away from the city lights? Come, follow me. Let me take you to a small market town in Nigeria called Uselu. In June of 2025, nearly 200 people fell ill, and you would wonder, what is the culprit? Dengue fever, a mosquito-borne virus disease. First, it's silent, but it spreads fast. The outbreak begins quietly. A few fever here, a few fever there, nothing alarming, until suddenly it becomes alarming. What saved Uselu from disaster wasn't luck. It was the swift coordinated action from the Nigeria Center for Disease Control, the Edo State Health Department, and the WHO. Health workers went house to house collecting data, collecting samples, educating families, and fumigating mosquito breeding grounds. Their efforts likely prevented hundreds more from falling ill. It was a win, but it also exposed something deeper. Why did this outbreak start in Uselu? That should be the question that you would want to ask yourself. A small town. Why did it take emergency intervention to control something that is highly preventable? The answer lies in a very harsh truth that rural communities are often the first to fall, yet they are the last to be equipped. However, let me show you what I mean when I say that disease does not have boundary. Follow me. Let me take you around the world and show you places where global outbreak has happened from and within rural community. The first one is chikungunya in India, 2023 to 2024. The outbreak started in a rural belt of Maharashtra and Tamil Nadu. Due to stagnant water, poor sanitation, and limited public health response, it fueled the spread, and before you know it, from these small towns, it spread into big cities and the mega cities of India. The second one is Ebola in Guinea. In 2021, the resurgence of Ebola outbreak began in Zerekore, a rural, remote area. It was only discovered because several people began to die in the community, showing how dangerous surveillance gap can be. The third one is Zika virus. We all know that Zika virus often starts in urban areas, but here in 2015 and 2016, in a very rural northeastern Brazil community, due to weak infrastructure, delayed detection led to the outbreak and spread of the disease, which became a global health concern. The fourth one is Nipah virus, and I know many of us don't know what Nipah virus is, but Nipah virus broke out in Kerala in India from 2018 to 2021. The outbreak began in rural farming community there in Kerala due to lack of rural critical care system. Something that would have been easily contained became almost nearly impossible to address. The last but not the least is anthrax in Zambia in 2023. In a cattle herding rural community, low access to veterinary and public health services triggered the outbreak, threatening both food security and lives. What does these communities have in common, you may ask? These are places with, first, no laboratory services, no early warning systems, few trained health workers, little access to public health education or preventable care. And yet, when a virus hits, it doesn't stay rural, it travels. So, when I say that Virus travel. Think about it traveling from Uselu to the next town, from the local trader in that market to an urban transport hub. Eventually, no one is spared, no place is spared. So, when we are talking about rural health, we are not talking about some isolated corners of the world. We are talking about the front lines of global health security. Because if we don't equip rural communities to catch the first fire or to catch the first spark, we will all have to deal with the entire fire, and then it becomes an outbreak. I have taken you through the problems. Now let me show you the solution, or at least some solutions, something we can do to begin to address the problem. So going back to my opening statement, it is that simple. Let's prioritize rural health system, not just as a human rights issue, but as a public safety imperative. We need stronger surveillance systems, tools, and processes. We need mobile diagnostic labs in communities so that tests can be easily run. We need expanded community health education, and we need locally well-trained outbreak response teams that are always on standby. If we can stop outbreak where they begin, we can protect everyone, from the market vendor in Uselu to the executive sitting in his executive chair in Lagos, from the rice farmer in Bangladesh to the commuter in London, because health systems are only as strong as their most neglected clinics. So, the next time that someone asks you, why rural health? You tell that person that I say, because it is where every crisis begins and where every solution must start. Did that sink in? I wanted to give you time to sink it in. So, this is What About Rural Health? I am Chinasa Imo, and we're just getting started. Thank you.